Hello and welcome to another session of Beyond the Script. Hope you all are doing well. We're still here in our pandemic fighting the coronavirus. I decided to talk about a different topic. We will have more information on coronavirus coming up, but I want to talk about this issue of the Zantac recall. Many of you, if you're watching TV, many of you may be at home watching TV and may have information about the Zantac recall. Zantac, the generic name ranitidine, is a drug that many of you know that is frequently prescribed for ulcers. It's an H2 blocker. And the FDA, so the FDA requests, I'm going to read this FDA news release, the FDA requests removal of all ranitidine products, parentheses Zantac, from the market. And so this has come up in the last few weeks. I heard about it first through the advertisement from many of the trial lawyers, and they're advertising to the general public. If you have taken Zantac or suffered cancer or loved one, call us now. So many of the trial lawyers that are trying to put together class action lawsuits against the company that makes Zantac. Another comment, I want to read to you some information from the FDA news release. Now, it's pretty interesting as to why they have recalled Zantac. Now, this drug has been on the market for a very long time. It's also over the counter, as well as having some prescription forms. So the U.S. Food and Drug Administration today announced it is requesting manufacturers withdraw all prescriptions and over-the-counter ranitidine drugs from the market immediately. This is the latest step in an ongoing investigation of a contaminant known as N-nitrosyl-dimethylamine. N-nitrosyl-dimethylamine. This is a contaminant in the Zantac in ranitidine medication. Now, the agency has determined that the inquiry in some ranitidine products increases over time when stored at higher than room temperatures and may result in consumer exposure to unacceptable levels of this impurity. So the N-nitrosyl-dimethylamine is found as a contaminant in the ranitidine, but the thinking is that when it's stored at greater than room temperature, the contaminant increases. So apparently there's some aspect of heat effect on the drug that's increasing this contaminant. Now, another interesting comment I want to read here is that, and this seems like a little bit of marketing on the FDA standpoint, is that the FDA is committed to ensuring that the medicines Americans take are safe and effective. We make every effort to investigate potential health risks and provide our recommendations to the public based on the best available science. Now, that comment, hello, Ms. Pettaway, that comment by the FDA is somewhat interesting because we know that, and it's been investigated and shown that of the generic drugs, about 90% of the active ingredients of generic drugs, and I think it's worldwide, but definitely in the United States, come from China. And a large percentage of active ingredients of over-the-counter drugs come from China, maybe the same percentage. The reason I point this out is because the FDA is not able to regulate the companies in China as effectively as they are here. And I'm putting that statement mildly because essentially I don't think they're going to regulate them much at all. And we've had situations before when contaminations have been found in medication that have had to been recalled. Recent drug, some antihypertensive drugs and angiotensin receptor blocker drugs have been found to have contamination with carcinogens. And some of the generic makers who are in China, who can be adequately regulated by the FDA, have these contaminations in it, and so they're discovered later on, then the FDA has to make a move to remove them. So we have another situation here where Zantac is being pulled from the market. Now, I can't say that this is a drug, a contamination that came out of China. I'm not trying to say that. I'm making the point that the manufacturing of our drugs is quite complex, and it's very difficult for the FDA to fully regulate the manufacturing, because our drugs come from many places around the world. A large percentage of the generic drugs come from China. So the risk in terms of having a contaminated drug is very heavy, or very high, I should say, because we don't have the ability to fully regulate it as we could if these drugs were all made here in the United States. So what I want to do is just talk about this drug, this issue, first and foremost. So we're going to talk about this contamination. What is this molecule, nitrosyl dimethylamine, N-nitrosyl dimethylamine? So what is it, and why has it caused such a problem? So Cindy Williams wants to know, should we stop buying generic drugs? That's a great question, Cindy. I'm going to get to that. I think you're going to guess at my answer, but I don't want you to have to guess. I'm going to get to that answer. That's a great question. I'm going to get to the answer to that question pretty soon. So let me share my slides with you. Now, last night I did a show and I shared slides. My slides were pretty small. I'm going to try to make them larger, but bear with me because I want to show a couple of graphics here that I think may be helpful. And I am going to put this on. So hopefully you can see this. I'm not going to spend too much time on these slides. So my title is Zantac Recall, and the subtitle is "It's Time We Consider Our Own Personal Recalls." Now, that gets at that question that was asked. But what is this nitrosyl dimethylamine, or DNMA? Well, it's a volatile, combustible, yellow, oily liquid nitrosamine. Has a faint odor. It emits toxic fumes of nitrogen oxide when heated. So remember from the recall that when the Zantac is stored at higher temperatures, the contamination is seen. So this drug reacts with heat, primarily used in laboratory research to induce tumor in animals. So the primary use of this drug is a carcinogen. It may be formed during the cooking of foods, especially cured meats and fish. Now I want to pause right there because many of you may remember a number of years ago, the World Health Organization had classified red meats and cured meats as class 1 carcinogens. And the big component was some of the contaminants, such as N-nitrosyl dimethylamine, components that were byproducts of these meats, especially when they were cooked. And so the fact these meats are carcinogen, now the pure meat forms of the meats are carcinogens, and the fact that they have this contamination, these nitrites, make them even worse. Now, it can also be found in vegetables, cheeses, alcoholic beverages, and fruit. As a comment in terms of contaminants formed in vegetables, oftentimes you may have toxic chemicals in fruits and vegetables, but vegetables also have antioxidants that come with them. So if you consume a vegetable that has what may be considered a toxin, that vegetable also has an antioxidant, which also protects you. Excuse me. So the product is reasonably considered anticipated to be a human carcinogen. So the thing is that we're dealing with a toxic agent that's found as a contaminant in this medication. It's not apparently not meant to be there. So the question is, are some makers of the ranitidine having this contamination there as a result of their manufacturing practices? Have they changed some of their chemical compounds such that this chemical product is there? Or is it just a byproduct of some of their processing methods? And we don't know the details of that. But the bottom line is that, this chemical compound has been found in unsafe levels, or presumably unsafe levels. And so Zantac is being removed from the market. And of course, the trial lawyers are out for their payday. Now, notice the payday isn't necessarily that for the people who suffered the injury. Typically what happens, you have these class action lawsuits, and a lot of money is passed around. Of course, the lawyers make a lot of money, and I think the plaintiffs get some money for their pain and suffering. But I think the biggest payday for the lawyers. Now, of course, the pharmaceutical companies tend to have this money in their budget. So, with all the money they've made on Zantac over the decades that they've sold this drug. They have money aside to pay off the lawyers for lawsuits, class action lawsuits like this. So the real people who are left holding the bag are the victims of those of us, patients who are taking these medications, or the loved ones of patients who are taking these medications who are suffering from this. So you have this drug that's a contaminant, and it's a problem. But is this problem isolated to Zantac? I mean, it's in the news. We see a lot of this. And if this was a one-off, if this was maybe one of 10, drug recalls, and it was really isolated, it may not be much of a problem. But the reason I'm talking about this isn't because of Zantac or ranitidine. I'm talking about this topic to bring about a broader issue. Now, in my on my page, I do a 3-part series on medication side effects. And medication side effects is a big issue because if you look at, and I'm going to share a slide with you real quick. There's a nice graphic I have here. If you look at, let's see here. Let me share the screen here. So if you look at the medication problem, so medication side effect causes over 100,000 deaths annually, greater than seasonal flu, greater than COVID-19, likely 17% of cancer, and 15% of cardiovascular disease. So medical treatment, by and large, is the third leading cause of death after cardiovascular disease and cancer. Now, it increases hospitalizations and hospital lengths of stay. There's a graphic here. Now, I had COVID at about 10,000. It's going to be maybe close to 100,000. So it's going to be close to medication side effects. We've had other flu pandemics that are around 100,000 people in deaths. But notice the medication side effects is 106,000. But look at here. Cancer is second. How many of these cancers are related to medication that we're taking? Well, this example shows that this drug that people are taking can cause cancer. But until now, we didn't know of this contamination, or at least it wasn't brought to our attention. So many people who have cancers are not just dying of cancer primarily, but they're dying really of a medication side effect. So if you take this 500,000 or almost 600,000 deaths here, how many of these deaths are attributed to medication side effects? And that's an important distinction here because, when we talk about cause of death, it gets pretty hairy. I've done many death certificates in my career, and unfortunately, it's not a pleasant thing. But when you're looking at the cause of death of a person, it's a complex mixture of things that go into it. So the person may have terminal cancer, they die from that. And so you say, okay, colon cancer or whatever cancer, or maybe have a cardiac arrest. But is there some other agent that's triggering that demise? It is triggering that end organ defect. I'm sorry, I've got to put my phone on vibrate here. But and so we often do not know what the underlying cause of these diseases, even though someone has a diagnosis of cancer. And this is a perfect example of how that can be the case. Good evening, Cynthia Ham. So Angela Jones Henderson, I took a generic Zantac for 6 years because of ulcerative colitis. Yep, and there are many other people in your boat who have taken these medications over time. And this is one of the things I'm getting at, is that we rely on these medications to treat our health conditions, but at the same time, these medications are causing other problems. And so the medications that we consume are designed for improving our health, but the problem is that these medications have side effects, and these side effects are not so much, we think of them as side effects, the phrase side effect implies are just a little something extra, but these side effects can actually be really problematic primary effects. I mean, sometimes you take a medication and the so-called primary benefit is minor, but the actual side effect can lead to something like cancer or heart disease or inflammatory disease or liver failure. So the side effect is really the primary effect because the drug ends up resulting in taking your life. And so we have to be careful when we considering medications. There's a few more graphics I want to share with you. I hope these slides are showing up okay. Somebody in the screen, the chat room, let me know if the slides are showing up okay. If they're not showing up okay, I'll have to get with my marketing person to help me figure out how to make them bigger. But anyway, I'm showing this graphic as following because polypharmacy. I see many patients time and again who come in and they are on, say, 15, 20 medications. Excuse me. It's not unusual for someone to be on multiple medications because they have multiple doctors and multiple health conditions, and they may get 3 medications from one physician, 4 from another, etc. Multiple drugs create multiple diseases. There's an underdosing or overdosing due to confusion. There's increased dementia with multiple medications. Drug interactions contribute to increased morbidity, and there's a paradoxical disease progression. So even though you're taking a lot of medication to quote unquote control your disease state, you're actually making things worse. And if you notice some of the Zantac commercials, they're talking about if you have cancer of the GI tract or the bladder or the liver or there are multiple organs that are affected. And even though this drug is designed to treat GI problems, the drug goes through what's called first pass. It's metabolized in the liver. So there's potential harm to the liver. Of course, in the GI tract, there can be indirect problems with the kidney. There are many drugs in my discussion on medication side effects. I talk about potential drug effects on the brain. I had a patient once who was on a medication that was designed for controlling blood pressure, and he had been on it for, I don't know, a number of weeks. And then one day he come in, he and his wife, and he said, look, I've been having these nightmares, and I'm waking up in the middle of the night, and I'm fighting my wife. I mean, the medication had him attacking his wife. So this was having an effect on his mental state. So I stopped that medication. It was a particular beta blocker. But then several years later, we were adjusting some medication and started on another beta blocker. He had the very same symptoms. So I thought it was that one medication. However, it was multiple. It was a drug effect due to the class. So when I thought it was that one particular medication, there was another beta medication in that same class of drugs that caused the very same symptoms. The point is simply this. These medications that we prescribe, and I've been in the business for a long time. I've written many prescriptions. We get many over-the-counter medications. People, when they get a cold, they get a headache or whatever, they pull something off the shelf, they take it, plus they're taking the prescription medication, etc. This is Russian roulette. I'm using the Zantac example not to fuss about Zantac itself. This is one of many examples. And the fortunate thing about people taking Zantac, well, this was discovered, hopefully in time for you not to suffer any major problems. But think of all the prescription drugs that you're taking. Think of all the prescription drugs that loved ones take. Think of all the over-the-counter medications that you're taking. And the problem is that we're taking too many medications. I've seen people coming in on 20, 30 medications, and people are, really making themselves sicker just based on the medication. So we really have to do something different. Now, I'm not going to belabor the point, but I do want to emphasize a couple of things. I want you to take these messages home. Point number one, these medications are foreign chemicals, period, end of story. They're not designed for our consumption. Now, do I prescribe medications? Yes. When the patient's very sick, I put them on medication. But in my mind, and also hopefully in the patient's mind, these medications are temporary as best we can. I'm always working to get them off, doing something with their diet, with their lifestyle. I'm doing something with maybe herbs, supplements to get them off these medications, get them on something that's more natural. I even try to reduce the dose, reduce the exposure. It's always a process, and I encourage you to do the same. If you're on lots of medications, encourage your doctor to reduce your medication load so that you're reducing the toxic load. Sometimes the medication may be worse than the actual primary disorder. Thanks. It's showing well. Just make it a little bit larger, but it's clear. Okay, I'll make the slides larger. Thanks for that tip. So the thing is that we need to know that these medications form. The next thing we need to understand is that our illnesses, whether it's a headache or a GI problem, etc., are imbalances in our body's biochemistry and physiology. So the treatment of these illnesses require getting in balance, not covering the symptoms up with a medication. So it's important that we understand that we should put ourselves in balance. If there's a nutritional imbalance, if somebody's standing on my foot and my foot's hurting, I'm not going to take 50 Tylenol. I'm going to try to get the person off my foot. If I have a vice grip on my thumb and my thumb is hurting, I'm not going to take Tylenol number 3 and I'm going to try to figure out how to get the vice grip from the thumb. Many of us walk into our doctor's office and we have vice grips on our thumb and we're getting prescription after prescription, procedure after procedure, when we can simply remove the vice grip. Now, removing the vice grip may be a challenge since you have to make some aggressive lifestyle changes. You have to do a nutritional detox, get up in the morning, exercise, you have to sleep, you have to commit yourself to some changes, but I guarantee it's going to be a much more effective treatment and you're going to get a much greater return on that effort than you will by simply taking a pill, okay? You have to take a pill. So Assura says, rebalance our system. I like that. I'll put that on the screen. We should rebalance our system. That's exactly what it is. When we're ailing or there's some illness, our system is off balance. We need to put our system back on balance. That's a great point. So the final point is simply this. These toxins, ranitidine recall. Let me do this here. Let's see here. Put that in the chat. So what I want to do is pose this question to you. So we're talking about the ranitidine recall or the Zantac recall. Question to the group, and I want you to respond to this. There's just a handful of people on, so we don't have a big group, so you should all. Is it time we consider our personal recalls? What do I mean by that? And let me see, all those who agree say yes, those who no. I don't want us to willy-nilly just get off our medications. That's not what I mean. Our personal recall is that we need to take an assessment of the prescription medication we use, take an assessment of the over-the-counter medication we use, and we need to say, how can I replace this with some natural lifestyle approach, maybe an herbal supplement? Let me see yes in the chats. I got a yes from Cindy Williams, yes from Loretta Montgomery, yes for Assura. So the point is we need to consider our own personal recall. We have to take control of our own lives. So what I'm going to do, I've got some colleagues here in Houston that I'm going to meet with, and we all practice functional natural medicine. We're going to sort of help you do that. We're going to try to put together a list of natural things to treat common ailments, whether it's blood pressure, headache, insomnia. And these may not be herbs. I'm not big on supplements and herbs. We'll have some of those things, but we may have other things that you can do, like sinus congestion, maybe a nasal rinse. Okay, a lot of people have sinus congestion and allergies, and they're taking over the kind of allergy medicine. You may need to do a nasal rinse. So we're going to come up with some common recommendations, that things that are scientifically solid that can be used to replace a pharmaceutical agent, etc. And we're going to pass this around. I'll do a special show, and I may have my colleagues on. In fact, I will have them on, and we'll have a conversation about this. They're smarter than I am in this regard, and we will share this information with you and give you something to take home in terms of what you can do. So again, I'm post-open heart. Some meds are mandated by cardiologists in spite of diet. Let me address that, Cindy Williams. So you're right. I'm not saying willy-nilly get off your medication. I prescribe it. So if somebody had a stent placed, you have to be on your antiplatelet at least a year. So we know some medications are mandated based on your condition. What I'm saying is, in terms of this recall, is recall the whole concept of totally relying on prescription medication procedures. Let's look at other things that we can do to reduce that medication load. If you're on a medication for your heart that's necessary, okay, that's fine. Okay, continue with that medication as long as it's necessary. However, when you are on something that you can remove, then remove it. Do something natural. Reduce the load. Okay? So we need to make a collective. Let's not wait for the FDA. Let's not wait for some big agency in the sky to do what we need to do for ourselves. Okay? Let's make a collective effort. Now, I'm going to make it my responsibility to help lead the way. I'm going to get my colleagues and people who are much smarter than I am in this area to come up with a list that we can start to build on to give you some things to do. So that's going to be our mission and so on. But I'll leave you with that. Until next time, I want all of you to take care of yourselves. I want you to get fresh air, sunshine, lots of rest, relaxation. Let me share this one last slide with you. Y'all gonna be tired of me sharing slides, but as during this pandemic, I've been sharing with people some basic things they can do to boost their immune system. Let me do this one last slide, screen share. Y'all gonna say he's addicted to sharing these PowerPoint slides, and I think you're right. But that's okay. I'm going to, let me do this. It's a little bit small. Give me a minute. So this is what I want you to do. Antioxidant rich diet. Many of you know this. You've seen my slides. Consume lots of raw fruits and vegetables, green smoothies, kale, spinach, blueberries, wild rice, beans. Use the following supplements and superfoods as needed. Vitamin C, 3,000 to 5,000 milligrams daily. Zinc, 30 to 80 milligrams daily. Blue-green algae, grapefruit seed extract. If you have symptoms of respiratory tract infection, and colloidal silver if you have symptoms of respiratory tract infection. That's a good regimen to have all the time, and I think it's something that would be beneficial to you and helpful if you get a cold, a virus, a pharyngitis, not just COVID-19. COVID-19 is not the only disease we know of. So keep that, make note of that. Put the video on pause and copy that down and keep it handy for yourself. But until next time, I wish you all the best. And we're gonna work on this movement of making our own personal recalls and making life better for ourselves and our loved ones. Thank you very much.